Hello and welcome back to another session for clinical skills. This is where we begin to talk about the physical examination of the patient. The consultation, the history is all about what's going on with the patient from the patient's perspective. And this is all about your observations, what you can verify with your eyes, with your hands, with your ears, all of your senses being used to learn from the patient's body and actions, all that you can to help them. And why do we want to help them? Because we believe they are human beings made by God. Therefore, they are extremely precious and valuable, and we want to take really good care of them. It's always where I like to begin, and it's true in medicine the world around that's the idea, whether you're Christian like me or Muslim like most of you guys or any other worldview. The idea in medicine internationally is that this is what we are here for, is to take good care of people. I entitled this Beginning Well because in truth I want to emphasize that the physical examination is not something at the end of our consultation with patients, and I'll talk about what I mean by that in just a second. So the context of the examination, where does it fit in the consultation process? Well, we've talked about the idea of introducing ourselves to the patient, then getting a history, getting the presenting complaint, the history of that complaint, and other history. And then by that point, we have some idea of what are the basic problems that could be affecting the patient, the differential diagnosis. And once we have that in mind, once we have an idea of what body parts, what body systems we need to examine, then we begin the physical examination in earnest as far as the patient's perspective. Now, from our perspective, where does examination begin? In truth, it begins way up here when we're introducing ourselves to the patient, because we're immediately observing things about the patient. And this is true from the beginning of the consultation all the way to the end of the consultation, beyond where we have listed examining the patient here. We're making observations, we're compiling information by our looking at the patient the whole time. So whereas the patient's perspective is subjective to us, the history they give us is subjective from the patient's perspective, we call the physical examination objective, because it's something we're only recording what we can see and verify with our five senses. First things first, as with consultation, we want to remember privacy is crucial. It's crucial for consultation because you want people to feel free to share anything they need to share. It's crucial for physical examination because you're going to be exposing different parts of the body and you want them to feel comfortable. You want their permission for anything that you may do, right? The patient's consent is a really important thing to have. We want to explain to them what we're going to do and why, and then we want their permission to do it. And then lastly, professionalism. In all these things, we're being professionals. We're not doing the things we want to do or the things we like to do. We're doing the things the patient needs, regardless of how we feel about it. Some examinations are not too fun to perform on patients. They're difficult, they're private, they're messy, and yet we do them. Whatever the patient needs, we do. So we have privacy, permission, and professionalism. Now, positioning is always going to be really, really important. In general, when we examine a patient, we're going to have the patient set up in a way that's comfortable for them. But as you see these bullet points down below, we want access to the area of interest. So it's not just comfort. We want them comfortable, but we also need access to the part of the body we need to examine, and we need to expose it, because one of the things we'll be doing is looking at that part of the body to see what we can learn. And in general, as a convention, we examine the patient from the patient's right side using our right hand. And that's true whether we're right-handed or left-handed. For the most part, that's just the international convention. And it's only important largely because when we teach exam skills, we're teaching them from the right side with the right hand. So if you want to reproduce what you're being taught, that's how you're going to have to do it. Okay, so the general examination sequence, this is the sequence we follow when we examine a part of the body. The first thing we do is we inspect that part of the body. We're looking with our eyes, right? We inspect. So inspection is just another word for looking. Next, we palpate, which is just another word for we feel that part of the body. We confirm what we see with our eyes, with our hands, and we gather more information by using our sense of touch. We do percussion. So percussion is tapping. We call someone a percussionist. That's why I have a gong here, when they play an instrument that requires them striking something. So in this case, we're going to strike the patient gently, but it will help us learn, because when we tap on things, there's a chance to see, okay, is it hollow? Is it solid? And I'll show you how to do that in just a second. Auscultation. That's a big, fancy English language word for listening. That's why I have the stethoscope there. And, we think of that as the quintessential doctor skill, right? When you think of what a doctor does, you probably think of listening with the stethoscope. But just a word that we really can't skip over all of these other important aspects. Getting a thorough history, doing an inspection of the area by exposing it and looking at it, palpating, feeling the area to learn more and map things out, doing percussion, tapping it to see, is it hollow, is it solid? If it is something we're tapping, sometimes it enables us to see the size, like when we're examining the liver. And then lastly, we listen. We do all these things every time we examine a part of the body for the most part. And the sequence is inspection, number 1, number 2, palpation, number 3, percussion, number 4, auscultation. You want to know that.
Hi, my name's Zach, this is Harrison. Today we're talking about percussion as part of the medical examination. So if you're a John Bonham fan, you're in the wrong place.
Percussion is performed by placing the middle finger of your non-dominant hand over the area to be percussed and applying pressure with your middle phalange. You then use the fingers of your dominant hand to tap, like so, producing a note that gives you a clue as to the nature of the viscera underneath. Things that are hollow or full of gas, such as bowel or healthy lung, give a resonant percussion note. Things that are solid, like liver tissue or nasty consolidated lung, sound dull. For example, this Star Wars Mr. Potato Head is hollow and hence resonant to percussion. By contrast, this copy of Leo Tolstoy's War and Peace is rather dull. To avoid nasty injuries, remember that sound can be improved by applying greater pressure using your non-dominant hand. A more forceful approach with the dominant hand is rarely necessary.
Okay, so just to summarize this first brief lecture and tell you where we're going next, but starting well is important. Physical examination starts after taking history generally. We'll talk more in the next session about how that's not strictly true. We want privacy and to offer the patient a chaperone if they need it. We want to make sure we have the patient's permission to perform anything that we're going to do. We want to value their autonomy, their ability to give us consent and permission, because they are in charge of their body and their consultation. We want to position the patient correctly always and expose the area we're examining so that we can go through the steps we talked about. That is inspection, where we look, palpation, where we touch, percussion, where we tap, and auscultation, where we listen. Okay, that's the end of this first brief lecture to introduce to you general physical examination. This is part 1. Next, I will see you guys for part 2. Thanks.